Sometimes school administrators ask me, why does your center prioritize working with students in schools? Well, schools are often the first place where attention difficulties, anxiety, social withdrawal, or risk taking behaviors become visible. Teachers may notice incomplete work, or distractibility, or emotional shutdowns, or peer conflict. Rather than immediately viewing these as discipline problems, we look underneath the behavior. Many students in international schools are navigating cultural transitions, identity development, and high performance expectations all at the same time. A counseling oriented approach within the school context allows early, supportive intervention. We prioritize practical strategies such as improving organization, building coping skills, and strengthening social awareness. Our philosophy is simple: the least invasive, most supportive approach is usually the most effective. Sometimes people ask me, what inspired you to start this work? Well, throughout my years as a counselor and educator in Bangladesh, I saw many students misunderstood. Some were described as unmotivated or oppositional, when in reality they were struggling with anxiety, attention regulation, or social processing differences. Others were overwhelmed by exam pressure or transitions between countries and cultures. I felt strongly that these students needed a safe place to be understood before being labeled. That inspired me to build a center focused on counseling first, not diagnosis first. I believe when students feel emotionally safe and supported, growth happens naturally. BJoy was created to offer that kind of environment. Sometimes parents and school counselors ask me, how do you support students who experience attention or executive functioning challenges? Well, when students struggle with attention, impulsivity, or organization, we first begin with understanding, not assumptions. Many students who experience symptoms of ADHD benefit from structured skill building rather than immediate clinical labeling. We teach executive functioning strategies such as task breakdown, time awareness, and emotional regulation tools. We also help students understand how their brains work in a strengths-based way. Often when students learn coping strategies and feel supported, their confidence improves significantly. Our approach is gradual and collaborative. We prioritize counseling-based support before considering more intensive interventions. Sometimes people ask me, what play therapy techniques do you find most effective? Well, I use child-centered play combined with structured emotional regulation tools and cognitive behavioral strategies for anxiety. Role play and guided social practices are especially helpful for students who experience attention or social processing challenges. The focus is always relationship and skill building, not labeling. Sometimes parents ask me, how do you describe your mission to schools and families? Well, our mission is to strengthen emotional regulation, executive functioning, and resilience so students can thrive academically and socially. We partner with schools and families to provide supportive, preventative care. Emotional health is foundational to learning. People sometimes ask me, what's the most effective way you've helped children? Well, the most effective change happens when we combine emotional regulation training with practical executive functioning strategies. When families reinforce those skills at home, growth accelerates. Supportive counseling often reduces anxiety and improves focus without invasive measures. Now you might be thinking, why do kids in school need counseling? Well, students today face academic pressure, social comparison, transition stress, and identity development challenges. Without support, anxiety or attention difficulties can affect learning and behavior. Counseling provides safe, structured tools before the problems escalate. So sometimes the parents of students I counsel ask me, how does counseling improve learning and focus? Well, when anxiety decreases and emotional regulation improves, the brain can focus on learning instead of stress. We teach coping strategies that strengthen attention, organization, and confidence. Emotional stability supports academic performance naturally. Okay, so what challenges do students face most often? Well, in international school settings, we commonly see exam anxiety, perfectionism, attention regulation difficulties, social stress, and of course, cross cultural adjustment challenges. Some students may also engage in risk taking behaviors during adolescence. Early supportive counseling helps address these concerns gently and effectively. Sometimes parents and teachers ask me, can you share a success story from your center? Well, without sharing any identifying details, I once worked with a student who would tell me before every exam, my brain is broken, it just runs away. They experienced strong exam anxiety along with attention regulation challenges, and sometimes even tried to negotiate with their pencil before starting a test. Instead of pushing diagnosis or medication, we focused on simple regulation tools, breathing strategies, breaking tasks into small steps, and practicing talking back to anxious thoughts. We also worked on executive functioning skills like organizing study time into short, manageable blocks. A few weeks later, the student walked in smiling and said, my brain didn't run away, it just needed instructions. The small shift in language showed a big internal change. Moments like that remind me that supportive, counseling-based care can be both effective and empowering, while always protecting confidentiality and the child's dignity. So how do we work with teachers and parents? Well, first of all, with consent. I collaborate closely with teachers and parents to understand patterns of attention, emotional regulation, and social interaction. We focus on practical, least invasive strategies that can be reinforced consistently at school and at home. Alignment between these adults creates stability for the student. So some of you might want to know, how does emotional health connect to academic success? Well, when students are overwhelmed by anxiety, transition stress, or attention difficulties, learning becomes harder, if not impossible. Counseling helps regulate the nervous system and strengthen executive functioning skills like focus and organization. As emotional stability improves, academic engagement follows. Many parents and teachers want to know, how do you know when a child needs help? Well, we look for ongoing patterns such as persistent inattention, emotional outbursts, social withdrawal, risk-taking behaviors, or sudden academic decline. In international school settings, difficulty adjusting to transitions can also be a sign. Early supportive counseling is preventative and far less invasive than waiting. Sometimes parents and teachers ask me, how do you know when a child needs help? Well, parents and teachers can look for small but consistent changes, like a student who suddenly avoids homework, frequently says, I'm stupid before tests, melts down over small mistakes, or forgets materials almost daily despite reminders. You might notice a child who used to enjoy friends now eating alone, or one who gets unusually restless and distracted or emotional during transitions between classes. Some students complain often of stomach aches on exam days or become unusually irritable after school. When patterns like these continue for several weeks, it may be a sign the child is overwhelmed, not defiant. Early counseling-based support, like teaching coping skills and emotional regulation, is far more effective and less invasive than waiting until problems become crises. An ounce of prevention truly is worth a pound of cure. A lot of times parents ask me, what's your process when meeting a new student? Well, first we begin with a parent consultation to understand the full context, emotional, academic, and developmental. Then I meet the student in a calm, safe way to first start building rapport before we introduce structured counseling support. This approach is counseling oriented, gradual, and collaborative. So, how do I make kids feel safe to talk? Well, safety starts with consistency, warmth, and clear boundaries. I explain confidentiality in an age appropriate language and never pressure disclosure. For students who experience anxiety or social communication challenges, we may begin through play or structured activities until trust naturally develops. So, what are some common misunderstandings about counseling students and working with schools? Well, many people think counseling is only for serious problems or that attention and social challenges require immediate medical solutions. Often, supportive skill building and emotional safety are enough. Counseling students and working closely with schools and parents is preventative and developmental, not labeling, not diagnosing, not pushing medications. Sometimes schools want to know, how can we benefit from having counseling programs? Schools see improved classroom climate, fewer behavioral disruptions, and stronger student engagement. Early counseling-based support prevents small concerns from becoming larger crises. A proactive program strengthens both academic outcomes and community trust. Sometimes parents and teachers ask me, how do you help kids build confidence and resilience? Well, we teach emotional regulation, practical coping skills, and executive functioning strategies in a strengths-based way. As students experience small successes, their confidence grows naturally. Resilience develops through supported challenges, not pressure. Okay, so what's the one message I want parents and teachers to remember? This is it. Emotional safety comes first. When students feel understood and supported early, growth happens more smoothly and with far less invasive interventions. Prevention through compassionate counseling makes a lasting difference.